Hello, welcome to Comcast Newsmakers, bringing you news and information from people making a difference in our communities. I'm Beverly Weaver, and joining me now is Dr. Katie Bakes, the Denver Health Director for Pediatric Emergency Department at Denver Health. Welcome. Thanks for coming in, Doctor.
Thank you.
Let's talk a little bit about some new things that are going on at Denver Health. You really saw a big increase in your pediatric admissions or people bringing their children to the emergency room, and you've really tried to do some new things in terms of offering for the kids at Denver Health. Tell me about that.
Yes, we opened our pediatric emergency department in September of '08 and saw a very large increase in our pediatric volume that was presenting to Denver Health. We are also opening a Child Life Zone starting next month, which is very exciting. It's being funded by Teammates for Kids, which is the Garth Brooks Foundation.
Yeah, this is really trying to make sure that you're serving the needs of children coming into the emergency department. Tell me how it's different from the way things have been done to this point, Doctor.
Well, previous to the opening of our pediatric emergency department, we had adults and kids mingle in the same area, which can be pretty traumatic for a child who's injured or ill to not be in an environment that is kind of conducive to healing and is particular for their needs. So in order to focus on what they really needed, we not only opened the pediatric emergency department, but increased overall our commitment to pediatric care throughout the institution in specialty care as well. And now we have a zone that's opening, which is the first zone that Teammates is opening in a hospital that is not a freestanding pediatric hospital.
Really? Very exciting. Now, it is a state-of-the-art therapeutic play environment for kids coming in to the hospital. What are kids going to see when they come in to that?
You know, it's really exciting, and I think for people who maybe haven't heard of Child Life, it's worth mentioning a little bit about what they do.
Yeah.
I was first introduced to Child Life when I did my fellowship at Children's, and ever since that first encounter, I refer to them as magical people. And the reason for that is because I had a child who I encountered who needed a laceration repair on his face. And he was extremely terrified. He had parents there who were also very anxious, had a sibling that was running circles around the room that they were trying to control. And I turned to the nurse and said, well, we're going to have to give this patient some sedation to get the laceration repaired. Well, the nurse suggested that we called in the child life specialist. And, you know, being very naive to what they did, I kind of rolled my eyes and said, okay, but call me when you're ready to give the medication.
Right.
And maybe 10 minutes later, she called me and said, we're ready for the laceration repair. And I said, oh, you've already got the IV started for the sedation. She said, no, Child Life is here.
Oh.
And I walked into the room, and the child was looking at a very distracting interactive toy. The parents were reading a book to the other child, and I proceeded to repair this child's laceration without any sedation or medication.
Wow.
And the child was completely unaware of what I was doing.
Yeah, so it really kind of diffuses some of that tension.
It really does, and they're able to approach children with play, and play for kids equals normalcy. And so they're able to describe what's going on, explain what's going to happen to the child within that kind of a framework so that the children can really understand what's happening to them and absorb it in more of a therapeutic way.
Now, we know Garth Brooks is involved somehow with this. Tell me what the
Yes.
connection is there.
So he started the Teammates Foundation, and if you ever get a chance to meet him, you'll realize right away that he's a very genuine person who really uses the resources he has to do good. And he's able to motivate people, and many people in the sports industry in particular, to give money for child charities.
In terms of where people can learn more about Child Life Zones, this is offered in other hospitals, as you mentioned, but obviously Denver Health getting a big coup in getting that based here.
Right. Other places do have Child Life. We are the only hospital in Denver that will have a zone, and it's going to be amazing. It's going to be 2 stories within our Pavilion C. If people want to know more about it or give to it, they can go to the Denver Health Foundation website.
All right, very good. Dr. Katie Bakes, thanks so much for giving us some information with Denver Health.
Thank you.
And thanks for watching Comcast Newsmakers. I'm Beverly Weaver.